I'm Dr. Harish Prasad. I'm an MD dermatologist and a dermatosurgeon practicing at Vitals Clinic, Bangalore. We have clinics at BTM second stage and Electronic City phase 1. Women lose hair too, but nobody talks about it, either at home or with friends and family or on social media. Let's understand these concepts and let's break the myths. The most common patterns of hair loss, what we see in women, is the first and the most common thing is widening of the parting area. So this is the most common presentation most of the women suffer from. The second most common is the thinning at the temple areas. So this is again one of the common hair fall patterns which we see in female. The third is the hormone related, which again commonly presents with excess of hair fall. Fourth is your post-pregnancy or post-intake of OC pills or any stress related. These are called like the telogen effluent. This is also one of the common conditions the female presents with. Genetic hair loss, as we see in men, can also be seen in women. Can we do hair transplantations in female patients? The answer is yes. We also do hair transplantation in females, but here are the facts what you have to know. What is the difference between male hair transplantation and female hair transplantation? First point is no shave technique. In men, we shave entire scalp, but in females, we do something called as no shave technique. As in, like we take hair follicles from the back and we don't like shave the complete back, but like the area which is from where we take the hair follicles, only that is being taken out. And in the front also we don't shave it, we place the grafts in between the hair follicles. This is the first difference between the male and the female transplant. Second point, women should have a good hairline, for which we use a very soft hair, the single hair follicles, to design the hairline. In men, we use them for 1 or 2 rows, but in women, we use 3 to 4 rows to give a natural appearing, wavy and good hairline designing. For women, the density is everything. At Vitals, we pack the hairs and give voluminous look, but it should be softer finish. That is what we do at Vitals to give a very good, beautiful, soft hairline to the female hair transplant. Female hair design is not similar to the male hairline design. In men, we do M-shaped design or round-shaped design, but in female, we give a softer, finer, voluminous hairline. That is the difference between the male and the female hair transplants. The timeline when we say for visible results after hair transplantation, first 3 months there will be baby hair growth, 6 months to 8 months there will be little volume restore. Full growth we can expect after 12 months. It gives you natural and wonderful voluminous with softer look in a hairline. Many myths about hair transplantation is women can't do hair transplantation. It's a myth because we do hair transplantations in females. It can be done in females too. So there is nothing like only it is for males or it cannot be done in females. Does female hair transplantation looks fake? Definitely not. Today with advanced treatments, with advanced techniques what we follow at Vitals Clinic, we give completely natural look for a female hair transplantation, and it can be done without any side effects or without any complications. Does female hair transplantation is a failure in people with hormonal issue? No. At Vitals, we evaluate the patient for hormonal irregularities, we correct them and then plan for hair transplantation. If you are a woman and having hair fall and hair thinning and you are not alone, there are so many people who have the similar issue. At Vitals, we address this issue by a simple hair transplantation which restores your confidence, restores your hair look.